Ten gets competitive, but the Abbott Big Ten We Give Blood Drive is one competition where everyone is on the same team. Here to tell us more is Abbott's chairman and CEO, Robert Ford. Robert, welcome to the New York Stock Exchange.
Thank you for having me.
How did it feel to ring that bell?
Oh, that's awesome. Experience of a lifetime, yeah?
All right, so can you break down this blood drive for us? How does it work?
Sure. So we're partnering up with the Big Ten to solve a blood shortage that exists in this country. So we're tapping into the Big Ten community, the students, the alumni, to see who can give the most, which school can give the most blood, and make it a competition. And we will announce the winner of that competition on December 5th at the Big Ten championship game, and the winning school, the one that can drive the most amount of donations, will win $1 million for community health and student health programs. So it's pretty simple. You go to big10.org/Abbott. You can see which is the closest blood donation center that you can go give blood. It's like 30, 40 minutes, Ashley. One donation saves up to 3 lives. Take a picture of your receipt, submit it onto the app, choose a school that you want that donation to count to, and that's what we're trying to do. We're trying to really increase the amount of donations in this country.
And I understand that Gen Z, there is this idea of giving back to the community. Is that why you are targeting, a Gen Z blood donor through going to these Big Ten schools?
I think that's part of it. I mean, this is obviously a generation that wants to do good. We know that. But I also think that we're seeing a decline in blood donations from the boomer generation, from the Gen X generation. They're getting older, and some of those eligibility criteria, they can't donate blood. So we're seeing that generation come down in blood donations. Now we need to see the Gen Z kind of come up also. So yeah, this is a good way to do it.
And what are some things or illnesses, or I know traumatic injury is one of them, where is blood used in hospitals?
Well, for a variety of situations. I mean, if we have a case, every 2 seconds, somebody in the United States needs blood. So you could think about it like if there's a traumatic, like an accident, they're going to need blood. Procedures, they're going to need blood. A pregnant woman giving birth, sometimes might have a complicated delivery, is going to need blood. People that are undergoing cancer treatment need blood. So the need is pretty massive. And we're seeing from a lot of our partners, the blood donation centers, they have like 1 day's worth of blood supply on. So we want to get ahead of this and rebuild the inventories back up.
Why do you think there's a shortage right now?
I think what happened during COVID is a lot of things have snapped back, right? We're back to traveling, we're back to doing things. And one thing we did notice is we didn't see the snapback of blood donations, and I think that's part of the older generation not being able to donate anymore and needing the new generation to step up. So I think that's one of the primary reasons, right?
Oh, right, and also anyone can get involved in this, right? You don't have to be part of a Big Ten school. You can go out and donate.
Sure, yes. I mean, that's what we're trying to do here. We're trying to raise awareness through our partnership with the Big Ten. Yes, there's a competition with the Big Ten schools, but anybody can go on and donate. And if you've got a friend or a family member or somebody that that goes to Big Ten school, you can make your donation count for that school. So anybody can do this.
What else should people know about the importance and really the urgency around donating blood?
Well, like I said, the blood need is very important. Every 2 seconds, somebody needs it. And if you look around the country, most hospitals and blood centers, they have like 1 day of blood supply. Now just think about that, only 1 day's worth of blood supply. So I think that's the reason we got to get ahead of this. We don't need to let it become a crisis or an issue. We can just get ahead of it. It's really not that hard. And 40 minutes of your time, you can save 3 lives. I mean, that's incredible. For 40 minutes, you could do that.
And are you able to talk about the regulatory environment? Because, around giving blood, is it safe to give blood?
Sure, it's very safe. I mean, I think especially in this country, the partners that we work with, I mean, that's fundamental, is ensuring that the blood supply is safe, not only from the donation process and make sure that's safe, but also how we test the bloods and make sure that the blood that is donated is safe to use. So yeah, it's very safe.
All right, thank you so much, Robert Ford, CEO and Chairman of Abbott. Thank you so much for joining us at the New York Stock Exchange.
Thanks for having us.